Okay, good afternoon, everybody. First of all, thank you for joining us today. My name is Richard James, and I'm part of the marketing team here at Collab. And I'd like to welcome you all to today's webinar. Before we start, I'd like to go over a few items just so you know how to participate in today's event. We've taken a screenshot here for an example of the attendee interface. So hopefully you should see something similar on your screens. To the left is the GoToWebinar viewer through which you'll see today's presentation. And on the right, you've got the GoToWebinar control panel where you can ask questions and select audio and stuff like that. So just to note that the control panel will collapse automatically when not in use. So if you do want to keep that up, then all you need to do is click View and then uncheck the Auto Hide Control Panel option. So I'm just going to run through the presenters for today. First up, we have Ian Colville, who is one of the product managers here at Collab. Then we have Andrew Nicholson, who is the Collab Cloud product manager. And last but not least, we have David Grant, who is part of the professional services and pre-sales team. Just to let you know, we would love to hear any questions that you may have, and you've got the opportunity to ask questions on the control panel on the right-hand side of the screen. You can send the questions in at any time, and then we'll gather all those up, and then we'll address them during the Q&A session at the end of the webinar. And also just to let you know that the webinar is being recorded, and we'll be sending you that recording in the next 24 to 48 hours. So before we start, I'd just like to get a feel for what your thoughts are on the subject of secure communications. So I'd like to run a very small anonymous poll just to see why people are here and what you're looking to get out of this session. So it's just 3 very simple multiple choice questions. And I'm going to run the first one now. And the first question is, are you concerned about the security of your healthcare communications? So I'm just going to give a few moments to everybody to fill that one out. Okay, we've got almost all the votes in on that one. Okay, so we're now going to move to the next question. Which is, are you planning to review the security of your communications in the near future? So if you'd like to select which one best fits you. Okay, I think we've got most of the votes in for that. And then the next one is, are you aware of the various security regulations surrounding this industry? Okay, so let's just take a look at the answers for the first question, which was, are you concerned about the security of your healthcare communications? And then you can see the result there. Fairly split. But 64% have said yes on that one. Let's have a look at the second question that we asked, which was, are you planning to review the security of your communications in the near future? And again, fairly similar on that one. And then the last one, are you aware of the various security regulations surrounding the industry? So we can see that 83% were either no or not sure on that one. So that's quite interesting. So thank you everybody for doing that for us. Okay, so we're going to be moving on our webinar. We'll be offering every attendee a free consultation from one of our technical consultants, plus $10 of free credit to use on the Collab Cloud telephony platform. So stay tuned to find out how you can get your hands on those. So without further ado, I'd like to introduce Ian Colville to take you through the next section of the webinar.
Okay, hello everyone. Good afternoon, or good morning, or guten Tag, depending on where you are. Just so as you know, I'm on 3, if you hark back to those images. So, healthcare, it's pretty big, right? No matter how you measure it, people, huge industry. Okay, despite its problems, it's still admired around the world as a shining example. It's a fact. And the budget for the NHS in the UK is over £120 billion. So we're talking about $1 billion, billion euro, billion pound industry that gives service providers a huge revenue opportunity. And that opportunity comes in part from offering things like, what would you say, enhanced applications with real-time voice and messaging capabilities. So, okay, there are many other opportunities involving medical devices and applying technology in other ways, like clinical decision support. But hey, we're a cloud communications API provider, so you can excuse us for focusing on the assimilation of cloud platforms. From strategically located secure infrastructure, Collab's cloud-based communications platform as a service provides the essential API building blocks for making and taking calls, interacting with calls, and for messaging. So that means that healthcare service providers supplying, for example, patient management and advisory and/or electronic health record systems have ready access to cloud-based APIs that are designed to meet their clinical communications needs. Collab's platform is operated on a pay-as-you-go approach. A healthcare service provider need only pay for the system when it's being used. And of course, the elastic nature of the network means that, when necessary, it can support large traffic spikes. So a system like that is scalable, it's cost-effective, it's globally accessible, and that means 24 hours a day, every day of the year. So for software developers providing solutions into the healthcare industry, the proposition consists of readily accessible APIs that enable the quick and easy development of many communications or messaging-related applications. Moving on to the next slide, I think. So the appetite for cloud-based solutions amongst healthcare providers is evidenced by the 2016 Healthcare Cloud Survey conducted by HIMSS Analytics on behalf of Level 3. It was undertaken in the US. So that survey indicated that, 84% of responding organizations were using cloud services. Furthermore, it showed that 73% of organizations were aggressively using or planning to move to cloud to host patient engagement and empowerment tools. So you can assume that the figures are not too dissimilar in the UK and in the rest of Europe. Healthcare organizations have many reasons for considering cloud services providers, and in doing so, they must take into account a number of different concerns. Performance and reliability is a significant one of those, and scores high is a reason for healthcare organizations to consider moving applications to the cloud. However, security and the protection of protected patient information is the top. Went on to elaborate that those considerations, that's security and the protection of patient data, are often heard anecdotally as a concern in relation to using cloud-based solutions. To take advantage of the opportunities, of course, it's essential that healthcare providers fully understand and comply with the regulations designed to protect patient information. In the US, the Health Insurance Portability and Accountability Act, that I'll call HIPAA from now on, and the Health Information Technology for Economic and Clinical Health, that comes out as HITECH, those acts are relevant. European healthcare service providers will generally not be affected by HIPAA obligations if they're not active on the US market. However, since providers' data processing activities are subject to similar obligations under general European law, including the Privacy and Electronic Communications Directive and the General Data Protection Regulation. That's a new regulation that comes in May 2018 after a 2-year transition period. So since the underlying trends towards electronic health files are the same, the US safeguards are a useful yardstick for measuring risk assessment and risk management by European healthcare service providers, specifically with regard to the processing of electronic health information. And it's not me saying that. That's a summary of a statement from ENISA, which is the European Union Agency for Network and Information Security. So those are the reasons why Acculab recently announced conformance to HIPAA and HITECH regulations. And that allows us to enter into HIPAA business associate agreements with our covered entity customers who provide healthcare platforms. The HIPAA regulations were introduced to improve the efficiency and effectiveness of the healthcare system in the US, including national standards for electronic healthcare transactions and security. And at the same time, it mandates privacy protections for what you call individually identifiable health information. So those HIPAA rules apply to covered entities and business associates, and there'll be more on those later. HITECH was a later introduction, which promotes the adoption and meaningful use of health information technology. But importantly, it also addresses the privacy and security concerns associated with the electronic transmission of health information. So the privacy rule addresses the use and disclosure of individuals' protected health information, which we could call PHI, by covered entities or business associates. It ensures that individuals' health information is properly protected, while permitting the disclosure of health information that's actually needed for healthcare, and of course to protect the public's well-being. Further standards within the rule provide for individuals' rights to understand and control how their health information is used, which you might expect, I'd say. The security rule encompasses federal safeguards for protecting PHI in electronic form, so we'll call that ePHI. And that must be applied by covered entities and business associates to ensure the confidentiality and the integrity of ePHI. So the rule allows the adoption of technologies to improve the quality and efficiency of patient care, such as those used in PMA, EHR, pharmacy, and laboratory systems. So we'll talk a little bit about protected health information on this slide. And so we'll start off by saying that that individually identifiable health information, so PHI, is in essence any information that relates to the individual's health condition or to the provision of healthcare to the individual. So that's information that identifies or can be used to identify the individual. The PMA and EHR services provided by Acculab's customers clearly include management and administration services, and both of those are included in the list of services that you can find identified in the privacy rule and in the transmission of ePHI. So customers use Acculab Cloud for a variety of solutions, including those involving patient management, advisory, care, diagnosis, results, rehabilitation, and of course messenger and information systems. All of those services and solutions involve the dissemination and transmission of PHI. And on that basis, any provider should have an interest in finding out how to best protect the PHI that their applications, their services and solutions are required to handle. I guess that's why you're listening to this webinar. So any business offering patient management and advisory or electronic healthcare record solutions, it's PMA and EHR solutions, they'd be obliged to ensure compliance with the HIPAA privacy and security rules, the HITECH regulations, and if you're operating in Europe, the GDPR, at least from 2018 anyway. So quite simply, if you want to use a cloud communications API platform to add real-time voice and messaging to your applications, then you need to ensure its use complied with those regulations. And only HIPAA Cloud makes that possible. So I said that we'd talk about covered entities and business agreements. So that's what we'll go through on this slide. So HIPAA Cloud makes that possible in two ways. And before I let my colleague take you through some of the measures that we provide to enable and ensure the security of PHI and so on, I'll just mention briefly these important contractual aspects to providing healthcare solutions. So there is a hierarchical model of contractual obligations that flows down from what is known as a covered entity. And covered entities are the label that encompasses health plans, healthcare clearinghouses, and healthcare providers that electronically transmit any form of health information that's included under those US Department of Health and Human Services standards. So a provider working with or providing services to a covered entity and who handles or discloses personal health information or personal health records, they're known as a business, or that organization rather, would be known as a business associate. And further along the chain, if you're a provider to a business associate, you're known as, guess what, a business associate. So in each case, you have this hierarchy of a covered entity and one or more business associates, each with back-to-back agreements that, back-to-back agreements with each other, I should say, on down the line. So not too dissimilar to standard subcontract arrangements. So a business associate agreement is, therefore, let's say, an essential contractual mechanism for anyone considering using a cloud-based communications platform as a service. That's a great mouthful, isn't it? Such as HIPAA Cloud. As part of the solutions that they offer to healthcare service providers in the US, of course, in the UK, and throughout the rest of Europe. In fact, probably anywhere in the world for that matter. So HIPAA can and has offered business associate agreements to other business associates providing services to covered entities. So that should give you some comfort, if nothing else. And so that's all from me for now. And I'm going to hand you over to my esteemed colleague, Andrew Nicholson.
My name is Andrew Nicholson. So what I'm going to go through is some of the architectural detail of HIPAA Cloud, firstly in general terms, and then to run through more specifically what we've done in designing a secure cloud communications platform. So HIPAA Cloud is a communications platform as a service. It provides the capability for two-way voice, SMS, and fax at a global level. In simple terms, a user of HIPAA Cloud would write a business application, which might be a conferencing application, a broadcast messaging application, an appointment reminder system, or an inbound IVR system to handle direction of inbound calls to different departments. And they use HIPAA Cloud to provide the inbound and outbound communications for the application. And all of that is done on a pay-as-you-go basis. So in terms of what we provide, there's the core media processing functions. These are hosted on Amazon's AWS network in multiple locations around the world. We provide inbound and outbound telecom capabilities, voice, SMS, and fax, at wholesale rates provided by telco partners that we have. We've designed in resilience on all the core components. We monitor the network 24/7, and this includes tests of the full end-to-end communication path all the way to the user by use of test calls. And we manage the network capacity so that we handle that. You don't need to worry about having the right capacity for what you're trying to achieve. So this slide then goes on and tries to explain a little bit about the specifics of what we've done to provide a secure platform for healthcare and other industries. So starting again with the core of the network, based on Amazon, we chose them as a solid infrastructure partner. They provide us with globally distributed data centers. Their network is designed to give high levels of resilience and scalability. They also comply with all the major security policy standards, such as ISO 27001 and the Service Organization Control SOC framework. So on top of using Amazon with all their inherent security aspects, we've also designed our secure platform with the use of dedicated hardware on the Amazon side, so it's not shared amongst other users. Encryption of file systems used for example, for log files. Within the Amazon infrastructure that we use IPsec secured connections. The connection from the customer platform into the Collab media servers uses TLS to encrypt the web traffic. And in the core, we also provide encryption of media files. And in our case, that means things like voice recordings, a voicemail message or a recorded message that you use to broadcast out, and also the fax image files that they're encrypted also. So this secure cloud design is a key factor for healthcare providers. Provision of service to the US market, where HIPAA and HITECH rules are in force. And as Ian said, we're able to offer business associate agreements to our customers in the healthcare space for the US, and that are not just applicable to the US market. They can apply to other markets where similar security schemes are in place, or indeed to sort of non-healthcare industries where security is a major concern. So that's all I was going to cover on the secure architecture. Just before I hand over to David, I just want to remind you that about the Q&A session at the end. So if you have a question, then if you use the right-hand panel, you can send that in any time. And now what I'm going to do is hand over to David from our pre-sales, who's going to dig a little bit deeper into some of the technology.
Thanks, Andrew. In the next couple of slides, I'm going to run through some suggestions on how to structure your Collab Cloud application to meet HIPAA compliance. But before that, I'll just provide you with an overview of how these applications interact with Collab Cloud. As Andrew said, Collab Cloud enables you to quickly add voice, fax, or SMS messaging features to existing applications through simple, high-level APIs. These applications sit on your own servers and interact with Collab Cloud's telephony resources. Your applications tell Collab Cloud the tasks, or as we say, actions to perform, and then Collab Cloud then performs these actions and sends back any results to your application. Possible actions include playing or recording audio, detecting key presses or speech, sending or receiving faxes, and adding in callers into a conference room. On this slide, you can see an inbound call to the left, Collab Cloud servers represented in the middle, and the server hosting the telephony-enabled application on the right. When the inbound call is received by Collab Cloud, a request is sent to the server hosting the telephony application asking what actions to perform. In this case, we want to play a prompt and request a caller enters some digits. In the response to the digits entered by the caller, sent to the application, we can see what they pressed, and then the application can decide what to do next. This request-response flow between the application and Acculab Cloud continues until the end of the phone call. In the next couple of slides, I'm going to provide some suggestions on how to structure your Acculab Cloud application when looking to achieve the HIPAA compliance with the privacy security rules. More specifically, we're going to look at authentication, that is, providing some form of protective measure within your application to make sure only authorized individuals, be they patients or healthcare professionals, have access to the private information. Use of SMS, so looking at how the contents of SMS messages should be structured so as not to leak personal information if they're seen by a third party. Encryption, so looking at how encryption of voice or fax data is done and how, for compliance, separation of the encrypted data and encrypted key is achieved. We're also going to look at the use of voice recordings, message playback and faxes, seeing how encryption is used with these features to ensure HIPAA compliance. One of the main ways to ensure personal health information remains private is to build a level of authentication into your application. For example, in an automated appointment scheduling service, this could include authenticating callers via a PIN or date of birth. The caller could provide these details using their telephone keypad or through speech, using Acculab Cloud's automatic speech recognition. Speech input is achieved using the getInput action, along with a grammar parameter outlining what we're expecting the caller to say. Predefined grammars are provided for digit input and simple responses such as yes or no. However, more complex grammars can be defined using grammar formatting rules, and in this way you could assign a unique passphrase to a user and then they could say this passphrase for authentication. Another option for providing an additional layer of authentication within a web-based application is two-factor authentication, where a one-time PIN is provided to the user either via SMS or voice call, and then the user enters this PIN during the login process to verify themselves. This can easily be achieved using Acculab Cloud's voice and messaging APIs. Here at Acculab, we are also developing voice biometric technology. Christened Voice Sentry, this product will enable you to replace time-consuming and frustrating inquisition-like verification processes simply by allowing your customers to authenticate with their voice. If you would be interested in more information about this product and product trials later this year, please contact us. Two-factor authentication. We've talked about how SMS can be used for two-factor authentication. Within some healthcare applications, it may also be required to send appointment notifications via SMS. However, it should be remembered that SMS messages are not sent over encrypted channels and remain in plain text on transmission. Also, a third party may see the message on a patient's phone. SMS is sent to a patient's mobile number, which could be used to identify them, and the contents of the SMS then qualifies as personal healthcare information and should therefore not contain any sensitive patient data. This means that rather than sending an SMS saying your appointment at the oncology clinic tomorrow is at 10:15, you should send something like your appointment for tomorrow at 10:15 is confirmed. Since Acculab Cloud allows two-way SMS, as well as confirming the time of an appointment, it is also possible to ask a patient to respond as to whether they are able to attend, and therefore reducing the cost of missed appointments. If a patient responds saying they're unable to attend, you could then automatically flag this to a receptionist who could HackerLab Cloud provides the ability to both encrypt and decrypt audio for recording or playback to a caller. We also provide the same encrypt-decrypt facilities for sending or receiving fax images. Protecting any personal healthcare information in this way is an effective way to comply with HIPAA, privacy and security. When performing encryption or decryption, encrypted files and encryption keys should never be sent in the same request or via the same path. This is because if one path becomes compromised and, for example, a third party gets hold of an encrypted file, they should not be able to get hold of the key to decrypt that file using the same connection. Using the example of playing an encrypted audio file, we'll see how HackerLab Cloud achieves this segregation as this slide builds. You can upload an audio or fax image to HackerLab Cloud using the Web Services API. This is done via the file write request. The file is then uploaded to your encrypted storage on HackerLab Cloud. The action request to play an audio file is sent separately along with the encryption key. When the audio is played, the media server loads the file from storage, and once the replay is completed, both the file and key are deleted from the media server. This means that the key and file are only stored together for the shortest required amount of time. HackerLab Cloud supports the advanced encryption standard in cipher blockchaining mode, where the encryption of each data block within a file depends on previously encrypted data blocks, as well as the encryption key. The encryption of the first data block requires the use of an initialization vector along with the key. There are a number of ways to generate the required encryption key and initialization vector, including using the standard OpenSSL libraries. This information is only sent to HackerLab Cloud when performing any tasks that require encryption or decryption, and you need to make sure that you store this information securely within your own network. There are a number of scenarios where encryption of voice recordings may be required by healthcare professionals and patients alike. Such recordings must be kept secure, and encrypting them at source, where they are generated on HackerLab Cloud, is one of the best ways to make sure they are secure. One such scenario could include a GP telephone consultation service, where patients are able to call a doctor for a consultation. The platform could perform the recording for later review, as well as for archiving to meet legislative standards. Another scenario could be a secure conferencing platform, where medical professionals are able to discuss their patient's condition. Such a platform could make use of whole call recording within HackerLab Cloud, so the recording of the conference could be stored for later review or for access by doctors unable to attend the call. In all cases, the encrypted recordings can be stored on HackerLab Cloud's secure media store and downloaded using the Web Services API for storage and archiving within your own platform. The main use case scenario for encrypted message playback would be relaying personal medical information or appointment notifications to a patient. The encrypted messages can either be stored locally on your servers or uploaded when required, or stored on HackerLab Cloud's secure media storage. Unlike with SMS, on voice calls, you will be able to add in some form of authentication, for example by asking the caller to confirm their date of birth, and then the message is able to include more personal information than if it were sent via SMS. As I'm sure you're aware, fax is still widely used within the healthcare market for transfer of medical records. HackerLab Cloud can be used to both send and receive faxes into an EHR or fax-to-email platform. In all cases, the faxes can be encrypted for storage to preserve the privacy of the personal information. So in summary, use of cloud-based IT communication infrastructure should be high on the to-do list for healthcare solutions providers, as it offers a cost-effective and scalable approach. You don't have to run your own servers. It can be outsourced, provided that it is a secure, resilient platform that ensures the privacy of patient data. It meets the relevant legislative standards, such as HIPAA, HITECH, or GDPR, and the platform can scale to meet your needs. HackerLab Cloud can offer all of the above. We have channeled decades of experience into telecoms hardware and software and have used this knowledge to provide you the HackerLab cloud platform that you see today, meaning you can trust us with your communications needs. I'll now hand back to Rich, who will be able to provide more information on how you can claim your free consultation and cloud credit before opening the floor to questions.
Okay, thank you, David. As you can see on the screen there, if you want to take advantage of our offer of a free technical consultation and $10 worth of credit to use on HackerLab Cloud, then all you need to do is email us at cloud@hackerlab.com, webinar offer 07, and we can arrange that for you. So thank you to David, Andrew, and Ian. We're now going to take some questions. You can still submit questions through the control panel on the right-hand side, and what we'll do is we'll gather all the questions together, and then we'll. First of all, I'm just going to mute myself, and then we'll find the first question. Okay, the first question is what programming languages do we support? So I'm going to pass over to David Grant.
So we provide a JSON-based REST API, which you can interact with that language of your choice, but we also provide REST API wrappers in Python, PHP, .NET, and Java. So hopefully that answers that question.
Okay, do I have to pay extra for all encrypted recordings? I'll pass that one over to Andrew.
Yeah, no, the way we price cloud is it's flat, so you don't pay extra. We've been talking about, so it's all included in our. So when you use, as we call it, the platform rate, making outbound calls, if you send the message, there's a message rate to send messages, which are all different for all the different countries.
Okay, we've got one to say, how do you currently support voice assistant services? I'll pass it over to David Grant.
Yeah. So I think what you might be asking about here is about automatic speech recognition. We, like I sort of mentioned earlier, we've got a that allows a grammar be recognised, and then based on the result of that grammar recognition, you can decide what to do within your application. And we also have a menu action that allowing you to sort of easily create a menuing system using. Hopefully that answers that question. But if it doesn't, then please let us know.
Okay, we've got a startup in India. Do we need to comply with HIPAA HITECH, or is it okay to be ISO compliant? I'm just going to pass that one over to Ian Colville.
So I assume from the question, be operating in the US from an Indian company, for example. But so if you are operating in the US, then yes, of course, you do need to comply. But if you're operating purely in India, in the HIPAA and the HITECH regulations don't apply, but I'm pretty sure that in your country there would be equivalent regulations, at very least equivalent to the general European data protection regulations that I mentioned. So there'll be some relevant regulations, not necessarily if you are
We've got one that say, do you provide audio-video solution with cloud-based security? I'll pass over to Andrew Nicholson.
Yeah, so no, the answer is no, we don't do video, we just do voice, SMS and fax. Do you provide a dashboard that shows me if the system's up and running and things like that? So at the moment, no, but that's under development, so it, very shortly we'll have that available. I think we're getting through most of the questions now. I'm just trying to see if we've missed any.
That's all we've really got. And obviously you can at acilab.com and we can answer any questions that you may have. Also, if you do want to take advantage of our offer of a free technical consultation and $10 credit on the Collab Cloud platform, just email that same email address and quote webinar offer 07 and we can sort that out. Once you leave today's webinar, you'll receive a short survey. We would appreciate if you would complete that and provide your feedback. You'll also receive a follow-up email in the next 24 to 48 hours and that will have a link to the recording of the webinar on there as well. So on behalf of Collab and our presenters, thank you for joining us for this webinar and we hope you have a great rest of your day. Thanks very much.